Hello everyone, welcome to my channel Dentin. This is Dr. Saib Singh. So the subject for today's video is going to be dental anatomy and dental histology, that is your DADH, which is covered in your first year. So whatever topics I'll be mentioning in the video are also mentioned in my blog by the name of Dental, the link for which is given in the description. This subject is being covered in two parts, that is dental histology, which is part 1, and dental anatomy, which is part 2. This is part 1 or dental histology. So starting with the first topic, that is development of tooth. Development of tooth, you need to know about primary epithelial band, dental lamina, number of tooth germs and genes controlling the patterning of dentition, only the names and their functions, bud, cap stage, early bell and advanced bell stage in detail with diagrams for a long note. Next topic is enamel. In enamel, you need to know the ultrastructure of enamel for a short note with diagrams. You should mention in detail about the enamel rods, their arrangement in deciduous and permanent teeth, rod sheath, keyhole pattern, etc. In characteristics of enamel, you should know about specific gravity, which is 2.8, thickness, that is 2 to 2.5 millimeters at the cusp and knife edge at the cervix, percentage of inorganic and organic content, and in detail about the organic content and the inorganic content. I mean, what constituents are there, what are the contributions, etc. For short notes from this chapter, that is short notes in enamel, you just need to know two points along with the diagram of incremental lines of Retzius, neonatal line of enamel, dentino-enamel junction, Hunter's-Krager bands, enamel lamellae, enamel tufts, enamel spindles, gnarled enamel, pericymata, enamel cuticle or Nasmann's membrane, and enamel pellicle. Also, for a long note in this chapter in enamel, the life cycle of ameloblast and amelogenesis comes as a long note from enamel. So that you should know in detail with diagrams. The next chapter is dentin. In dentin, you need to know the composition of dentin in detail, the classification of dentin for a short note with diagrams, odontogenesis and dentinogenesis in detail with diagrams for a long note. Short notes from this chapter include Tome's granular layer, Tome's fiber, hyaline layer of Hopewell and Smith, and contour lines of Owen. The next chapter is cementum. In cementum, you should know about the thickness of cementum, that is, it is the thickest at the root apex and in interradicular areas of multi-rooted teeth, that is 50 to 200 micrometers of thickness, and cementum is thinnest at the cervical areas, that is 10 to 14 micrometers. These values and the areas you should remember, they can be asked in your MCQs. Also, you should know for an MCQ that is cementum is an avascular tissue. In composition of cementum, you should know about collagen and predominant collagen types in cementum. Classification of cementum you need to know in detail, with special focus on difference between acellular and cellular cementum and the difference between intrinsic and extrinsic fibers. For short notes from this chapter, you should know about cemento-enamel junction, that is CEJ, all the types with diagram, cemento-dentinal junction, the histology with diagram, incremental lines of Salter, any 2 to 3 points with diagram. Coming to the next chapter, that is pulp. Pulp, you should know the zones of pulp for a short note in brief with diagrams. You should know for MCQs that the smallest pulp is in the lower central incisor, 0.006 cubic centimeter. Largest pulp is in the first molar, that is 0.068 cubic centimeter, and the principal cells of pulp are fibroblasts. Odontoblast structure you should know in detail with diagram and special focus on active phase and quiescent phase. In coming to pulp stones or denticles, you should know in detail with diagrams. Fibroblast and fibrocyte you should know in brief the structure with diagrams. Blood supply of pulp again for a short note in brief. Coming to the next chapter, that is periodontal ligament. You should know the classification of periodontal ligament cells in detail. Principal group of period fibers are very important, so you should know that for a short note. The classification of fibers along with the functions in the diagram. This is very frequently asked in PDL, so you should know in detail. Oxytocin fibers, again it is asked as a short note. Blood supply of PDL, it's a short note. Do study about the specialized vascular features of PDL, example cervical plexus, perforating arteries and fenestrated capillaries. Functions of PDL, again you have to study in detail. Coming to the next chapter, that is alveolar process. You should know the definition of alveolar process, gross morphology of alveolar bone. You should study in detail about alveolar bone proper and supporting alveolar bone. The cells of bone and bone histology have to be done in detail. Short notes in this chapter include reversal lines, resting lines, bone resorption formation coupling, and Sharpie's fibers. Coming to the next chapter, that is oral mucosa. You should know the definition of oral mucous membrane. Functions of oral mucosa, just in brief, only the names, the headings of the functions. Structure of oral mucosa you need to know in detail. That is epithelium, connective tissue, lamina propria, submucosa, everything in detail. Again, classification of oral mucous membrane you should know in detail. Structure, location, histology of keratinized and non-keratinized epithelium in detail with diagrams for a long note. So in specialized mucosa, you should know the structure and histology of taste buds and papillae. Coming to vermilion border of lip, this is asked as an MCQ or Viva. So you should just know the definition of vermilion border of lip. That's it. And you should know the name of cells and any one function each under the keratinocytes and the non-keratinocytes. So basically, you should know the names of the keratinocyte cells and the non-keratinocyte cells with one function each. Coming to the next chapter, that is salivary glands. You should know the classification of salivary glands in detail and the ductal system of salivary glands and salivary gland cells in detail with long note with diagrams. So this is the end for the first part, that is the dental histology part of DADH. So if you found this video to be useful, please don't forget to like, share and subscribe to my channel Guide Dental for further updates. Thank you so much.